Hey there everyone, my name is Maggi Rocha. I'm a certified advanced practice social worker and qualified treatment trainee with Behavioral Health Clinic. Today we're going to address a topic that's come up a little more recently over the past decade or so, same-sex parenting. Now, there's a lot of information out there about dangers and risks that are associated with same-sex parenting. In this video, we'll dispel some of those most prominent myths and assumptions tied to this different family dynamic, and hopefully ease any concerns that you may have as a same-sex parent yourself, or somebody who meets or works with same-sex couples. Let's get started. While a large portion of same-sex parents and couples may identify as homosexual, there's also a substantial amount of same-sex parents that don't fit into this category. A pretty good example would be if an adult woman chooses to live with her mother to raise a child. This would also be an instance of same-sex parenting, since the grandmother and the mom are both in the household to raise the one child. Another instance would be, let's say you have two brothers living in the same household who are raising their children together. This would also be an instance of same-sex parenting. So it might not always be what we think it looks like. While same-sex couples might not be able to have children through traditional means, same-sex couples can have the same capability and desire to build families just as any other set of parents. Many same-sex couples have children from previous heterosexual relationships. They might utilize a surrogate, adopt, utilize IVF and fertility procedures, or they just might have a younger family member that they've taken custody over. Just the same as any opposite-sex couples who might have trouble with conception or just go through a situation that leads to them having a child in their household. Census data actually suggests that there's over 650,000 same-sex couples living in the US. Nearly 1 in 4 of those households includes at least one child under the age of 18. So that means right now it's estimated that there's at least approximately 3 in every 1,000 children that lives in a same-sex household. And this number continues to rise. Research has actually shown there's no marked difference in the overall mental health and child-rearing practices between same-sex and opposite-sex parents. Same-sex households often divide household and family labor relatively evenly and report the same satisfaction with their family relationships as opposite-sex families. Research also hasn't found any data to suggest that same-sex couples are in any way unfit parents. On the contrary, evidence has shown that same-sex families are equally as capable of providing supportive home environments for children, and adolescents of same-sex parents also describe equally warm and caring relationships as their peers who have opposite-sex parents. Studies have shown that there is no difference between children of same-sex versus opposite-sex parents in terms of gender identity development, toy preferences, activities, interests, or occupational choices. Children of same-sex couples are also no more likely to express attraction to the same sex and appear to develop sexual orientation along the same developmental patterns as children of opposite-sex couples. So, no. Children of same-sex parents are not going to be more likely to end up gay or confused about their gender identity than children of heterosexual couples. There's also no evidence that children of same-sex parents experience more deficits in personal development than children of opposite-sex parents. Additionally, there's no difference in the development of peer relationships for these children. While children of same-sex couples do report more instances of anti-LGBTQIA+ rhetoric, they don't report more incidents overall of childhood teasing or victimization than their peers. So, do they get bullied more often? No, but their bullying might be a little bit different than maybe children of opposite-sex parents. So to cap off this video, there's not really any evidence to suggest that same-sex parents are in any way less fit or capable of being effective parents to their children. And there's not really been any empirical study to date that's found children of same-sex parents to be overtly disadvantaged in any significant way in comparison to children of opposite-sex parents. Overall, research has consistently shown that home environments provided by same-sex parents are just as likely to support and enable children's healthy psychosocial growth as any other. If you have any further questions and concerns, or would just like some extra help with parenting in general, feel free to reach out to us at Behavioral Health Clinic. And we'll see you next time. Bye!